What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, May 31st, 2024. That's right, it is the last day of June. If you're new to my channel, welcome to my channel. This is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of viruses out there, and we do talk about a good majority of them. It seems like just about every day we're talking about something different that's coming along. Right now, we're obviously talking about the increase in COVID that's happening in many places around the world, from the flirt variants, and we're also talking about H5N1. We're not going to talk much about H5N1 today, but we do have a lot of news and data that is in today. So if you're new, subscribe down below. Give this a thumbs up if you like the content. The more people that hit that like button, the more YouTube pushes out this content. Let's try for between 100 and 125 like button hits today. And of course, share this with anyone you know and leave your comments down below. As stated, it is a very busy news day, and we have a lot of data and just a lot of things in general that I want to share today. I'm going to try and keep this under 20 minutes. You know, I like to keep my videos under 20 minutes. Sometimes we do go over. I got a feeling today could be one of those days. We'll see. All right, starting off, this is a new study. 1 in 20 infected with mild COVID in the first wave are still battling illness. Study shows, and new vaccines offer little protection against this year's variants, experts say. All right, let me explain a couple things here. First off, a lot of people that had the first wave of COVID, you know, the Wuhan 1.0, I had it. I never had a positive case, but I had all the symptoms of it prior to testing becoming a thing. Well, a lot of us still deal with symptoms. Another issue is that they're talking about the vaccine. Well, you know, constantly new variants are coming along. And for example, Novavax. We're learning now that Novavax is going to be targeting JN.1. Well, that's good. We're already into the flirt variants, KP.2, KP.3. So these variants, I mean, we try and get one step ahead, then the virus gets one step ahead of us. Every time we come out with a new vaccine, there's already some other variant that is a step ahead of that, and that is a problem. Moving on now to news out of Australia. Australia is now not doing so well. Elective surgeries are now being paused as hospitals are now operating in internal emergency mode. They are seeing hundreds, and I do mean hundreds, of staff members in the hospitals that are now out with COVID. In fact, in this article, Dr. Lawrence said around 270 staff in metropolitan hospitals were currently off sick with COVID, and more than 140 patients were in hospital with COVID and flu. And I have been seeing comments in different places, whether it be X or elsewhere, of people saying in Australia that they are getting hospital acquired infection. They're in for one thing, and then they end up testing positive, and it becomes quite serious, or is becoming serious. So this is a problem that is not good, and of course we need to monitor. It sounds like the KP.3 variant is one that is causing issues over in Australia right now, or at least in some of Australia. All right, COVID-19 in France. Latest official figures, and then of course they talk about symptoms of new variant. But COVID-19 in France is seeing an increase. It says from May 20th to 26th, emergency admissions and hospitalizations for suspected COVID-19 continue to rise for the 6th week running, 6 weeks now. SPF said, with 575 compared with 427 the previous week. So yeah, that's a pretty big increase. This represents an increase of 35% across all age groups. However, levels remain at a lower level than in previous years, which that is also the case in many places. But hey, a rise is a rise, and it does indicate that there is a wave going on. Hawaii has also been seeing a multi-week rise here in the United States. They have kind of been on a path of their own from the rest of the United States with a long-term rise, which, I don't know, maybe it's a sign of what could be to come. You decide for yourself. It says here, the Hawaii Department of Health has tracked consecutive increases in COVID positivity rates over the past 5 weeks as new variants take hold in the island. And they do talk about KP 1.1, KP.2, and KP.3, which are all descendants of JN.1. And we can pull up the Hawaii COVID dashboard, which shows the positivity rate is rising and is now medium in Hawaii. All right, moving on to this. New Mexico reports first measles case since 2021. So the first measles case has been reported since 2021, and it sounds like it is 2 cases in New Mexico. Moving on, I will try and document that onto the site at some point this weekend. Not going to have time to do that this evening. All right, Mike Horger with his weekly posting on his forecast. The PMC COVID-19 forecast. Taking a look here, he says we're in an unusual place in the pandemic, where our forecast is showing a steady state, approximately 430,000 infections a day. This is for the United States for the next month. That's an estimated 22,000 plus, resulting long COVID cases a day. And if we take a look at the chart here, we can see here the red line, that's the composite of the forecast. It's expected to go remain flat, and then you see the turtle, which is forecast 1, cheetah, which is forecast 2. At the very end of this, around June 28th, it does show a slight increase that would start occurring just before 4th of July. However, there are other things that we can look at. That's a forecast. Let's look at wastewater scan. I do believe I have that lined up next. Yes, I did a short thread on Twitter. Now, wastewater scans, sometimes their data can show one thing, and then it can change. We'll have to see what happens, but right now, on the most recent update from Wastewater Scan, in this thread I put thread. Wastewater Scan shows that we are now having a faster rise for COVID in the U.S., and you can see that on the chart here. You can see it's starting to go up faster. Again, this could correct a little bit lower in the coming days. We've seen that happen before, but at the very moment, on the latest update, it is showing a bit of a faster rise now. The West Coast, while they're starting off from a very low level, all places are starting off from a low level, is now rising rapidly. And you can see here, right on the chart, look at that. You can see around May 19th it was going up, and now it's going up even faster. It's almost going straight upward. Some parts of California actually did drop, which was Los Angeles. I was looking at that earlier. Los Angeles did drop, but again, there's a lot of wastewater sites in California. So some of them are still rising, and there's other wastewater sites in the West Coast, which does represent there being a rise. New this week is the Northeast, which saw a big rise for COVID. Look at this. Again, starting off from low levels, but in this case, it was around 300 pathogens, and now it's already almost up to 500. So that's a pretty significant increase. The Midwest is remaining this flat this week and has even dropped slightly, so that's good to see. The South, take a look at this. As of May 19th or 20th or somewhere around there, the South, it's starting to pick up the pace. So again, levels are rising in the United States, and I put in conclusion for wastewater scan data, we are clearly seeing a rise in the U.S. right now. We are coming off of very low levels, but the rise is becoming more and more noticeable. KP.2, KP.3, and other variants are responsible for the rise. And I also I should add that it did not help that we just had a major holiday weekend where people traveled and went to resort towns. This also is likely helping to increase the rise in COVID. And again, I stress, we could see some corrections here where maybe some of this actually corrects a little bit lower, because you saw on Mike Horger's model, it's not expecting to see a big rise right now. We're expecting to remain flat for the next month, but wastewater scan data would say otherwise. It's a shame we do not have public biobot data anymore, so we'll just have to see what happens going forward. I also tweeted this. Has anyone noticed an increase in masking this week post-Memorial Day weekend? I have seen a very noticeable increase in the past few days with more people masking, and some in N95s. This tells me they are sick or know someone who is sick, and this is just outside of Philadelphia in various places and in the grocery store. I've noticed several more people masking in the grocery store. Some of them were even in N95s, and a few people, it's relatively early with this, a few people did put on here that they are seeing an increase in masking. And wow, there's a lot more comments, so I'll have to go through them later on. All right, taking a look now at the national allergy map 46% of the country is in medium status, and we do have red now showing up in Oregon and red in portions of New Hampshire as well, meaning pollen levels are high there. Mask up if you want to. You should mask up for that because it would help you with your allergies, and of course continue to take your allergy medicine. I took my allergy medicine, my Allegra, for today. All right, taking a look at air quality values, and I'm going to refresh this, and we can see here that in the United States our usual hotspots continue to be a problem, but there is some good news today. Look at Texas, a bit better. Some yellow spots in portions of the plains, but you have to go to extreme southern Texas see any bad air qualities. Of course, any shift in the wind, if the wind starts coming out of the south-southwest again, then you run back into the problems with Mexico. California, a little bit worse today with air qualities, and the East Coast is not doing bad at all. Taking a look at what is going on with heat-related illnesses, this map will fill in as we get closer and deeper into the summer. The first day of summer is not here yet, but already we are seeing some heat-related illnesses starting to increase in various places. Speaking of climate change, take a look at this. Vermont becomes the first state to enact law requiring oil companies to pay for damage from climate change. So that's good. If they're, whatever they do, they're in Vermont, fossil fuel companies, drilling for oil or anything that they do, guess what? Vermont is going to require them to pay for damage should it lead to more damage from climate change. Remember, Vermont last year, they saw a tremendous rainstorm that did historical damage. It happened last year back in July. It was a really bad storm that they had in Vermont. Taking a look now. Heat advisories for today, just confined to southern Texas. Want to learn more about climate? You can do so on X, where I do talk about climate on my climate Twitter page, which is Climate Data Report, or I should say Climate X page now. We don't call it Twitter anymore. To me, it will always be Twitter. All right, moving on now. Speaking of X, taking a look at Philadelphia EMS totals for Thursday, May 30th. 730 EMS incidents were reported in Philadelphia County yesterday. Let's do a live look at Montgomery County. Whoa, that's a lot of traffic incidents. Not too bad right now for EMS calls, just 8. So, Philadelphia was lower yesterday and lower than it's been in the last few weeks. And take a look at this. Montgomery County is currently lower. Can we be lower in Chester County? Well, we do have a few calls. Seizures, syncope, hemorrhaging, dead on arrival, that's what DOA means. Respiratory difficulty, injured person, and EMS standby. Not terribly busy. Taking a look at what's going on with Walgreens this week, the positivity rate increases do continue. I really wish we would have something out of Hawaii. Would be interesting to see what the positivity rate would be there, or if they would get much in the way of testing, because we know Hawaii has been seeing for 5 weeks now increases in various different metrics, including the positivity rate, but of course we can't see it here on Walgreens. Nationally, 18.6% positivity rate, 17.5% last week, up 1.1%, and testing was down ever so slightly. All right, drum roll please, we have some new CDC data today. New wastewater data is in from the CDC, and 8 sites now make the red. That's the highest level for COVID, and take a look at this real closely. Some of them are in Hawaii. That's right, Hawaii is on the map here now. That is good to see. Of course, we will do our full wastewater update on Sunday. I also did want to show this real quickly. We do have a couple more states that are reporting high levels of COVID. Wyoming, Utah, Nevada, New Mexico, and now Florida are reporting high levels of COVID. Moving on now, let's see. We'll take a look at Canada's data tomorrow. I have to show you this. Epidemic status for COVID. It's now in the growing phase in the following states, and it's a lot of states. Maryland, it's definitely growing now. Florida, growing. Texas, growing. New Mexico, growing. Arizona, growing. California, growing. Nevada, growing. Wyoming, growing. Washington, growing. Alaska, growing. And Hawaii are now growing. I think that's all of them. Hope I didn't miss any. Connecticut, likely growing. Virginia, likely growing. South Carolina, likely growing. Georgia, Louisiana, South Dakota, and Utah are all now in the likely growing phase for epidemic status with COVID. So we're starting to pick up the pace with more states now jumping to the other side of the line from stable and uncertain. And I can tell you right now, there are some states here that are not estimated at all. New York State being one of them. You will see momentarily that New York State is either likely growing or is growing because cases are starting to rise in the state of New York. And we can see here things are not estimated in North Carolina, also not estimated in Missouri, and a whole bunch of other states. We still do have some places that are likely declining or declining. And look at this, in the Midwest, that is still happening. And we saw on the wastewater scan that your wastewater is actually, stable to even dropping slightly still. So it would make sense that it shows it up there. And it would make sense that we also see the growing phase in the West Coast. And if I had to guess, Oregon is either likely growing or growing just based on all the other states and what we have seen with wastewater scan data. And some good news is we are seeing declining in Oklahoma. Why is that such good news compared to anywhere else? Well, Oklahoma typically tends to have the highest long COVID rate. All right, moving on now. Not really much I can show you from the CDC. This won't update till next week. This is the latest variants, and pretty much I'm just going to say it. We're in variant soup. KP.2 leads the way at 28.5%. KP.3 is increasing. It's at 12.7%. We'll get a new update on this next week. If I had to guess what's going to happen, KP.2 will rise a little bit more, and KP.3 will probably be at least north of 15%. I don't know. That's my guess for next week. Taking a look now at the influenza map, not all that bad. We're in low across much of the country, and even minimal in many places as well. The actual matter of fact, I think just about almost everywhere is in minimal status now, aside from just a couple places. DC is still in low status. All right, taking a look now at influenza type A, and we can see we still have some above average or even high in portions of Illinois and portions of Oregon. For that, New Jersey today, 196 hospitalizations, and I do need to zoom this in. This is 69 out of 70 hospitals reporting. They corrected May 29th to 203 people in hospital. Currently, they have 5 people on a ventilator, 19 people in the ICU, and discharges, 22 discharges at this time. Taking a look now at what's going on in New York State. For the first time, and I did tweet this out just a little bit ago, I believe it was March 5th. Let's go back here. For the first time since, yes, March 5th, New York State has reported more than 1,000 cases of COVID. 1,029 cases reported. March 5th, they had 1,017. So, yes, we're definitely starting to see a rise here. And thus the reason why I'm saying New York State is either likely growing or is growing for COVID at this epidemic status. And then when we take a look at what's going on with hospitalizations, you can see it here. I have it a little zoomed out today, and you can see here, it's pretty noticeable now that there is a slight increase in hospitalizations. They currently have 524 people in hospital, 39 people in the ICU, and let's take a look at hospital admissions. Have not seen that in a while. Quite honestly, I'll be honest with you, I always forget to show this, but you know what? It's noticeable here as well. You can see here, it is starting to go up here, the bars. Each one's starting to go a little bit higher. They started the week this week with 277 admissions, and you can see here, part of the reason why that was such a big jump is it was a holiday weekend, but then when we take a look back on the 20th, you can see it was 211, so, I mean, that is a big jump, and we can see today, 112, that's higher than where it was at this time last week. Alrighty, folks, look at that. I did it. I kept this video under 20 minutes. That's all I have for today's update. We added a lot of stuff. We talked about a lot of stuff today. Some of the stuff I will try and get to the website. Won't be able to do that tonight. Maybe. We'll see. I have to go back out to work tonight, but we'll try and add that stuff tomorrow to the website. And of course, leave your comments down below. I may not be able to get to all of your comments this evening. I'll try to get to them tomorrow. If you're new around here, you liked what you just saw, give it a thumbs up and subscribe down below. And of course, share this with anyone you know. I will see you all again next time. Hopefully we'll have something in the good news department tomorrow. We had no good news today. Until I see you again next time, have a fantastic Friday night, and of course, if you miss any of our updates this weekend, have a fantastic weekend. See you next time. Stay safe, everyone. Thanks for watching.